leather goods in San Francisco. Now, prior to that point, there had been only one pediatrician in all of Bayview to serve more than 10,000 children. So we hung a shingle, and we were able to provide top quality care regardless of ability to pay. It was so cool. We targeted the typical health disparities: access to care, immunization rates, asthma hospitalization rates, and we hit all of our numbers. We felt very proud of ourselves. But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, Dr. Burke, have you seen this? In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC, and together they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand, better than we ever have before, how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear.
The talks that formed modern democracy took place in Philadelphia 250 years ago. And the talks about the future of democracy continue here today. Plan your trip to Philadelphia, where revolutionary thinking is a way of life.
But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed. So for me, this information threw my old training out the window, because when we understand the mechanism of a disease, when we know not only which pathways are disrupted, but how, then as doctors, it is our job to use this science for prevention and treatment. That's what we do. So in San Francisco, we created the Center for Youth Wellness to prevent, screen, and heal the impacts of ACEs and toxic stress. We started simply with routine screening of every one of our kids at their regular physical, because I know that if my patient has an ACE score of 4, she's 2.5 times as likely to develop hepatitis or COPD. She's 4.5 times as likely to become depressed, and she's 12 times as likely to attempt to take her own life as my patient with 0 ACEs. I know that when she's in my exam room. For our patients who do screen positive, we have a multidisciplinary treatment team that works to reduce the dose of adversity and treat symptoms using best practices, including home visits, care coordination, mental health care, nutrition, holistic interventions, and yes, medication when necessary. But we also educate parents about the impact of ACEs and toxic stress the same way you would for covering electrical outlets or lead poisoning. And we tailor the care of our asthmatics and our diabetics in a way that recognizes that they may need more aggressive treatment given the changes to their hormonal and immune systems. So the other thing that happens when you understand this science is that you want to shout it from the rooftops, because this isn't just an issue for kids in Bayview. I figured the minute that everybody else heard about this, it would be routine screening, multidisciplinary treatment teams, and it would be a race to the most effective clinical treatment protocols. Yeah, that did not happen. And that was a huge learning for me. What I had thought of as
it's one of my headphones.
I now understand to be a movement. In the words of Dr. Robert Block, the former president of the American Academy of Pediatrics, adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. And for a lot of people, that's a terrifying prospect. The scope and scale of the problem seems so large that it feels overwhelming to think about how we might approach it. But for me, that's actually where the hope lies. Because when we have the right framework, when we recognize this to be a public health crisis, then we can begin to use the right toolkit to come up with solutions. From tobacco to lead poisoning to HIV/AIDS, the United States actually has quite a strong track record with addressing public health problems. But replicating those successes with ACEs and toxic stress is going to take determination and commitment. And when I look at what our nation's response has been so far, I wonder, why haven't we taken this more seriously? You know, at first, I thought that we marginalized the issue because it doesn't apply to us, right? That's an issue for those kids in those neighborhoods, which is weird because the data doesn't bear that out. The original ACEs study was done in a population that was 70% Caucasian, 70% college educated. But then, the more I talk to folks, I'm beginning to think that maybe I had it completely backwards. If I were to ask, how many people in this room grew up with a family member who suffered from mental illness? I bet a few hands would go up. And then if I were to ask how many folks had a parent who maybe drank too much, or who really believed that if you spare the rod, you spoil the child, I bet a few more hands would go up. Even in this room, this is an issue that touches many of us. And I'm beginning to believe that we marginalize the issue because it does apply to us. Maybe it's easier to see in other zip codes because we don't want to look at it. We'd rather be sick. Fortunately, scientific advances and frankly, economic realities make that option less viable every day. The science is clear. Early adversity dramatically affects health across the lifetime. Today, we are beginning to understand how to interrupt the progression from early adversity to disease and early death. And 30 years from now, the child who has a high ACE score and whose behavioral symptoms go unrecognized, whose asthma management is not connected, and who goes on to develop high blood pressure and early heart disease or cancer will be just as anomalous as a 6-month mortality from HIV/AIDS. People will look at that situation and say, what the heck happened there? This is treatable. This is beatable. The single most important thing that we need today is the courage to look this problem in the face and say, this is real, and this is all of us. I believe that we are the movement. Thank you.
Oh yeah, which one, did you guys watch in Dr. Hunt's class? Did you watch this one? Did she show it like the first day of class? It was last year. Have you also watched this? It would be this kid. This one's good. Remember this kid? So she only showed you 1 and 2, I think. All right. We're gonna roll with this one. Thank you.
Did you see what?
Maybe what I'm trying to finish. Remember this one? This one's good. This one will make you cry.
I never wanted you to have my life. Please.
Yes, are you the boy's mother?
Yes.
He's completely safe. So you don't have to worry about him.
Wait.
He's been put into protective custody.
Protected for what? I love you. I still love you. Don't worry, I'll be back. It's gonna be quick. I promise. Okay? Yeah.
So she's either hooking or getting drugs. I don't know which one. They kind of leave it open-ended. And then obviously cops are called. He only sits in there so long. Cops come, social worker takes the kid, and then the story begins.
We need to come back.
I think it is drugs because they show the pills, so it could also be hooking for drugs. Like they leave it open, however you interpret it.
You haven't started, okay? We promise it's 5 minutes. 5 minutes. Count it. 5 minutes. Okay? 5 minutes. I love you. Okay? Are you still there? I'm not gonna see him today.
We received a phone call from the boy's
I was gone for 5 minutes. What are you talking about?
He is safe. Is there anyone that we can call? His father, his family? You will be able to see him, just not right now. Hello? Yes, this is
Can I tell you what I honestly think?
she. Yes.
I think it is a terrible idea.
Yes. Hello. Yes, I see.
You want to be ashamed of yourselves. A bunch of big guys like you. Taking out poor little woman like this.
So, let's get in, okay?
So, I don't understand. How was it? There was nowhere else for
So,
me.
we asked the mother who she knows. She specifically asked me. So, in her mind, okay, buddy?
What's your name?
Process.
I'm Gabby. It's very nice to meet you.
She did specifically request you. You're going to touch your back. So you look at me with that check, as well as a home check, and eventually I'm like, we'll just process so that you're more comfortable with the process.
And if we say no, what happens to it now?
If you say no, you will go to approval.
Okay.
But again, the goal is to.
I'm hungry. Okay, go find food in the kitchen. I think there's some pizza. I'm hungry. Hungry. It's one this time. Come on. Come on. Don't worry, I'll be back. It's gonna be quick, okay? Come on.
Morning, Debbie. Thank you. How are you? Like pancakes?
Yeah. Just think about it.
You know, she's crying. You know, sometimes it's okay to be nice, or just ask her nicely.
I think your parents are gonna love him. Such a sweet kid. Come on. He's just a little child, not a convict.
I'm not saying he's a convict, he's not just a child. We don't know where he comes from, we don't know anything about him. We don't know what it means for kids. We just don't want you to get too attached.
Wait, her dog lived.
So a lot of times there's a temporary placement. If they are taken, they give the mom a chance to recover or do recovery stuff. Because the overall goal is family reunification. If any of you have taken Karen's class, you can hear her talk about that. They do want to reunite the family. A lot of people know that even if you are taken from your family at some point, you will want to go see your mom and dad when you turn 18. No matter what, how messed up, how, we all want to know where we came from. So that's what their goal is. So I'll continue.
Just about there. Hey guys. You bring anybody? You? Did you make me here? Come in. Hey. Just one minute. Please do. She is really the fastest. Got those? You got it? Okay. Go ahead. Come on. Okay. Let's get this one.
Oh yeah, that's his mom's sweatshirt, so it might have her smell on it. If you know anything about like attachment theory, he probably does find comfort in having that sweatshirt and the smell.
When you were born, you just looked at me with those bright brown eyes. And I just knew you would love me and protect me forever.
So, yeah, the movie started out, the kid was left alone in the truck. We're not sure if mom was into drugs or something, but CPS took him. He's temporary placed, but often with Child Protective Services, they want to work on reunification of the family. If mom's recovering from drugs and alcohol, sometimes they give you 3 months temporary placement, and then when there is recovery, they want to reunite the family. So that's kind of this is showing for the next 12 minutes.
Really special to Daddy. Something that helps you not get lost.
Did you find this?
Good packs are backpacks with basic necessities.
So with temporary placements, I know the chair of our department, he teaches in psychology. He had a temporary placement, and they eventually did go back to mom. The title of this is Remove 3, Love is Never Wasted, because the time he spent in this placement, obviously he's getting important living circumstances out of it. Excuse me. Social worker drives a Prius. I joke that all social workers drive Priuses. I used to drive. Gets good mileage.
Hey, you guys look at it's raining outside. Hey, buddy, your mom is so excited to see you. She's been working so hard, going to all our meetings. She has a new place to live. She can't wait to have you back home. Are you excited to see her?
Hey, buddy. You're right here. Wanna come with me? Remember how I gave you the mechanical room? Can we do that again? Want to take this little girl in here so you can get some rest? This is the moment that you were born. You were a star. You just took the room. Remember, it's a change. It just looks at me with those big brown beautiful eyes. You take care of Mama.
What is this? Clean this up!
I just knew, I knew you would never leave me. That's right.
Do you want to know what I also think?
Yes.
I think it is a terrible idea.
Stay right here. With your giggles, your smiles, your laugh, your tears. I love you. And you are a part of me. No one can take that. Moving right on. And your time here is a big part of you. Just don't ever make us mistake.
Yeah, she finished, well, so this is probably the social worker, but he is going back to his mom. And she finished, it sounds like drugs and alcohol, because they said she was going to all her meetings, she's doing so good. I think she has a new baby too. So the family is reunited, but he stayed there. It could have been 3 or 6 months, because it looked like through Christmas.
Did you find this? Wow. This was my dad's. Thought it was gone. He used it when he would go sailing. He loved boats and sailing, and he loved the ocean. And yeah. Do you know what this is? This is a compass. And what it does is basically, you see that arrow there? So whichever way you move it, that arrow points north. And that helps you find your way.
Little baby.
Does it almost feel,
There's 3 of those movies. I know Dr. Hunt showed it. Did she show you both 1 and 2? Or maybe just 1 even. So that's 1 and part 2, that's 3, and there's a 4th one. Those are the hardest developmental years for kids, and we're going to get into that soon. That's also the normal time, as crazy as it sounds, the most frequent time a breakup can happen, like mom and dad, or it's hard with kids, so it's hard to stay together. Has anybody seen 7 Days of Heroin in Cincinnati? That's another one I was going to try to show later. That was filmed as we're the epicenter of heroin in Cincinnati. And it won a Pulitzer Prize. I can show you the trailer. I know you have to go, but I'll show you the first minute because it is kind of striking. But in 20 minutes from here, kind of.
Babies will be born to heroin-addicted mothers. Courts will take children from addicted parents. Taxpayers will spend heavily to lock up drug users. People will overdose in gas stations and parks and school parking lots.
I know Dayton's probably
It's the first day of another week of the heroin epidemic.
as bad as Cincinnati.
Over the next 7 days in greater Cincinnati, at least 180 people will overdose. 18 will die.
And so this was made in the past decade where Cincinnati reached its peaks with overdoses and family reunifications, child protective services, fentanyl, because it was about that big of a crumb of fentanyl that could overdose you. Sometimes they would try to crush it up and just put it in heroin so it would be stronger and you could sell it for cheaper. You could buy it online in China for really cheap. For a long time, I do think that's illegal now, but the fentanyl is killing most of these people then. We'll watch that Thursday because I know you have to go. I do have everything still on the YouTube channel if you need to catch anything, but I'm going to do some of the PowerPoint. I always say, we all know how to make a baby. This is how the baby is formed. They talk about all the stuff with child development, the fetus. So in your mom's stomach, you responded to pain, light, touch, taste. At 26 weeks, you could hear sound vibrations. You recognize the mother's voice at birth, and you can go. I know you have to go. But yeah, my channel is Dr. Trouth at Central State, so if you ever need to catch something, you guys sign in there for attendance too. Some people. It is Dr. Trouth at Central State. As long as they don't kick me off for copyright. Sometimes when I show those videos, they say it's copyright. You can't show that. So the mother's emotions affect the fetus. How do you guys think that's possible? Like if she is stressed out all the time, if she is like in a domestic violence situation, if she is drinking or using. Oh, I got it. What's that? Yeah. Yeah, so depression, anxiety related to lower birth rate. So they have research on that. Like if you have anxiety and depression, if mom is stressed all the time, her blood is flowing with cortisol, which is the stress hormone, and it does affect our brain development. 10% of time spent in the quiet alert state. So the baby's like already starting to learn. They got fingerprints at 7 weeks. I think they have a heartbeat. They'll learn how to recognize when the baby has had enough particularly in the NICU. So one assessment they do is to assess reactivity and regulation. That's the baby IQ. So newborns can focus on objects. They prefer contrasting complex patterns. So like if we were standing next to each other, they would stare at your clothes. Like if you have, patterns. Mine's boring, or if I put this on, like they like that. They're like drawn to those contrasting complex patterns. They prefer high-pitched sounds, like a female voice. A lot of people are like, "Hi, baby, how you doing?" Like that type, that's how you talk to them. They prefer sweet over salty, just like most of us do. We like our sugar. Acidic or bitter, so nobody really likes bitter, but we love sweet. They can imitate facial expressions, such as sticking out their tongue. Have any of you ever heard of the still face experiment before? I'll show you this one. This is only like 2 minutes. So, still face experiment. I don't know if they do research on this anymore because it's actually kind of, and I think I'll play this dude. I can't, let me see here. Unless if it's too long. If it's too long, I'm not going to play it.
Extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. And the still face experiment that the mother did was she sits down and she's playing with her baby who's about a year of age. And she gives a greeting to the baby gives a greeting back to her. This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this, and then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, "Come on, why aren't we doing this?" Even in this 2 minutes, when they don't get a normal reaction, they react with negative emotions, they turn away, they feel the stress of it, they actually lose control of their posture because of the stress that they're experiencing.
I'm here. And what do you do? Oh, yes. Oh, my girl.
It's a little like the good, the bad, and the ugly. The good is that normal stuff that goes on that we all do with our kids. The bad is when something bad happens, but the infant can overcome it. After all, when you stop the still face, the mother and the baby start to play again. The ugly is when you don't give the child any chance to get back to the good. There's no reparation, and they're stuck in that really ugly situation.
So, and it could be postpartum depression, it could be just like normal. That's where having more than one person raise the baby, maybe a family, it is normal for mom to have the baby blues, or for even dad to have some depression. What are some other things you guys think could stop us from interacting with our babies? Like I mentioned, the heroin epidemic. So if some of them are shooting up and they pass out, and the baby's like trying to get your attention, That would be freaky, but you can see in 2 minutes the baby's flipping out, like, where's my parents? Like that's how they learn. Like so much of their brain is developing those first 2 or 3 years. It's so vital. And because it's a lot of work, it's hard on the couples. What about screen time? Or like we all have these cell phones all day long. I even notice it with my kids. Like it's so tempting. They say every text we get is like a tap on the shoulder. Like somebody just like, and you want to look at it, and you want to see the things that are going on. And it is very normal to want to have those. I do a lot if I can outdoors and have them do the garden or like fill up the pool. And I still have my phone. It's like I have all kinds of stuff going on. I have to work 2 or 3 jobs. Like sometimes I'm on call, and I hate it because it does affect them. It does affect their development. We're all, I say, congrats to all of you doing school now. Is you have so many distractions nowadays. Your friends texting, your cell phone, your computer in front of you. Like I remember, I had a pager in college, and like sometimes I would get a page, and it would be like, call it this number, 911 is emergency. But we didn't have Wi-Fi until I was done with graduate school. Like we didn't even have, all the computers we had to go to were wired to the wall. So we couldn't bring a laptop to class and check Instagram and chat with our friends and say, what are you eating tonight? We had to pass a note. So it was still the same distraction, but like you guys got it coming from all angles. And I said this in the previous class, how many percentage of Americans do you think have a finished college degree, completed? What percentage of, even the world has a completed college degree?
Like 30%.
You are spot on in America. And then globally, it's what, like 5%? Because it's hard to finish. I took 5.5, 6 years. I almost failed out. It's hard. And with all the distractions you have coming at you now, like it's even harder. So stay the course. Stay focused. I know it's hard because I constantly have distractions going on. I'm still on call. I work at hospice. I see clients in a private practice. I teach online in a graduate school in California. Like I got 4 kids under 5 at home. So it's just like, there's always something. And there's always something that will pull you away that it's for your good to finish. And our bachelor's, you can get a license. Your final year, you can take the licensure exam your last semester. So if you graduate in May, you could take it in January. If you graduate in the summer, you can take it in like June. And if you take it in the fall, if you graduate December fall graduation, you can take it August this month. So you don't have to get a master's, but if you do, it usually double your pay. And it's only 1 year. We're accredited, so that fact that it's only 1 year is amazing. So I don't want to go too far. We got a $590,000 grant to do horticulture therapy here on campus. So I have a meeting at 3:30 to get that going. That's kind of exciting because we're doing plants and therapy together in the greenhouse. But I did want to get through a little more of this PowerPoint. Anybody ever heard of colic?
Mm-hmm. Isn't that the scary stomach?
Yeah, it says prolonged bouts of crying in the late afternoon and the evening. It lasts from approximately 2 weeks to 4 months of age, peaking around age 6. And yes, often it is digestive problems. So like the rule of 3, you diagnose it if you, a well-nourished, healthy baby crying for 3 hours a day, 3 days per week, and 3 weeks out of a month. And then organic causes are constipation, lactose intolerance, meningitis, or abuse. So as a social worker picking up if it is abuse. Primary causes of the colic are gastrointestinal, psychosocial, or neurodevelopmental.
My grandmother used to say that it was like if you gave a baby bottle and the milk was gone and they were sucking on the air.
Oh yeah, I can see that. That can cause indigestion. And you do, like you're right, you want to be careful with that because they will suck a bunch of air in their stomach and get all gassy. Mine will drink the bottle from the night before, like especially the 2-year-olds. And I'm usually not that worried about it. My wife's like, no, they're going to get sick. I'm like, yeah, They haven't yet, but I'm sure I can see where milk could go bad, you know, like it's gotta be refrigerated. So like the newborn states are quiet alert, active alert, crying state, drowsiness, quiet sleep, active sleep, instance use sleep to control their environment. I think adults sometimes do too. Like when you're stressed out, if you're able to, I don't sleep well when I'm stressed, but some people like avoid the world by taking long naps or sleeping, you know, a lot. You can go into the dream state and whatnot, so. Drinking and smoking is another way we do it, but different things that do. I may actually wait to show some of these newborn reflexes till next time. I kind of did want to stop there and see questions, discussion, you guys. Got anybody know friends with a baby, family with a baby? How are they handling it?
My friend got a baby. She got her baby last year in April of our senior year. Wait, no. Was it last year?
In high school?
Yeah, we was in high school. She had the baby, I think, on this day, April of our senior year. And,
How's she
it was
doing?
going good. It was going good at first.
Right, yeah, they are. They don't move much.
The baby was smaller. I feel like she had like more support and people was like willing to watch her more.
Yeah, yep.
I feel like now that the baby older now, she's 1 year old now.
So she's walking almost.
No, she's not walking. She should be walking.
Right.
She's not.
So you can walk anywhere from 11 months to 15 or 18 months.
Yeah, she should be walking somewhere. But I just feel like now that she's older, I feel like she don't have as much support as she did with the baby.
Right.
It's like smaller.
Yeah.
So they like do put a lot on her. And she also, my friend also young, so like it's like she still wanna go party and have fun sometimes.
Right.
So it's like hard finding a babysitter and stuff.
Yeah. Yeah.
I also feel like she don't cause I know a lot of people they like have their kids like learn at an early age, like teaching them ABCs, like even singing to them or having them play at the time or something.
Yep.
She don't do stuff like that. I know like she should.
Right.
The baby could be more advanced, but
Right. It's hard. Yeah. It's. And then what other supports does she have? What are the supports? She lives at home, I guess.
She live with her auntie, but like their relationship is rocky.
Right.
It's getting a little rocky. The more and more they got older. So she's supposed to be moving out in September.
And it's expensive.
To get her own apartment. And she did just get a job. Like this is her first real job that she ever had for real.
In what city?
This is I live in St. Louis, Michigan.
Okay.
She trained in Lansing, Michigan.
So is the cost of living a lot up there?
No, it's cheap.
Okay.
I feel like rent is like $900.
And is there child care? Is there?
Yeah, they get like week and stuff like that. And
Oh, okay.
I think she get cash assistance too.
Yeah, okay. It really does take a village because it's hard, and you're right. People start abandoning you, especially when the kids start moving. Like they're cute when you can hold them, and they just sit there, and then they start crawling. Then they walk, then they talk back to you. And
Yeah, it's like the older she got, less people they didn't want to watch her as much the older she got. Cause she's more busy by now. She's all over the place, she touches stuff, grabbing stuff.
Right. It's more than just like sitting there watching movies on your phone and making sure the baby doesn't like throw up. So that's kind of what I'm saying is it just gets harder the older they get, and we see just so many couples struggling with it and finding ways to get them supports and get them things that they can.
I think another factor also was like when she first had the baby, like she still was with her baby daddy, but they broke up. I'm gonna say like last year, and I feel like ever since they broke up, he feel like he don't have to, support her as much as he did when they was together. So like I feel like he was more of a dad when they was together, and now that they're not together, he just feel like he just took a step back. I feel like.
Right. Well, and if they have to pay, maybe they think they don't have to show up. Like, well, I'm paying for stuff. I don't have to go there.
But that's the thing too. He don't really pay for nothing.
Right.
She will ask him, but like he won't. Like he just I don't know.
Right. Yeah. No, it's hard. I mean, I waited until I was 42 years old to have kids, and I had 4 and 4.5 years, and it's not easy.
And I noticed that too, because I noticed that this generation is not having kids as often as it was in,
1.6 kids per couple, we start off saying
Yeah,
that.
because it used to be, we had like in Dayton, we had a school called Longfellow because you weren't allowed to be in high school and be pregnant.
Oh, okay.
Among the regular,
Mm-hmm.
you had to go to an alternative school. I don't know if you remember that. But
Yeah.
you had to go to an alternative school if you got pregnant and stuff.
Right.
But a lot has changed since then. I know that there's less and less teenage pregnancies than they were.
Right. Mainly because the more access to abortion or birth control and just different things that make less pregnancies. But you're right. It's they even have First Step Home in Cincinnati for drug and alcohol people in recovery that have a baby so they can do a recovery program with the baby. Because sometimes you're using the drugs or alcohol to cope with the stress from the baby. You know what I mean? Like, I'm gonna drink a few tonight because this baby keeps crying and I don't know what to do and I wish it would shut up. They do push, obviously, never shake a baby, but that does happen as you're like, stop crying. And like the emotion takes over you. They also have hbse for a crib. They say put them on alone on their back in the crib, and they're pushing that everywhere in Dayton, Cincinnati. We have high infant death syndrome all over the Midwest. We have the highest. So they're really trying to get the word out and educate people. So, well, any questions? Genogram is 3 to 4 generations. Did you guys get to see a picture I made of one? Let me see if I can find it. I feel like I sent it to my mom because I made one. And let's see here. Oh yeah, I do have one. That was it. And so I did 4 generations, but I had my grandparents that were born in like the early 1900s. And then you had maybe colors, that would be they both had cancer. One of my sister's husbands currently has cancer. On this side, it's more heart surgery and heart stuff. 3 of my siblings have hemochromatosis. That's iron overload in your system. There's alcoholism on both sides of the family, but then I only did my 4 kids. So obviously we can do more detail. I did this by typing the information into Google Gemini, and it made this for me. And I'm fine if you guys want to use it, because obviously you're putting your info if you want. You can also sketch it by hand, snap a picture, and upload it if that's more comfortable to you, because not everybody wants to give Google all their info. I guess I probably shouldn't. I think I've thrown a tax return in there once and said, help me make a budget. And I'm like, wait, I probably shouldn't put my tax return out there. I don't have much to steal, but that's okay.
Can you post that?
I did post a video that shows you how to make one of these in the assignment on D2L.
Okay, yeah, I just need, can I take a picture of it?
Yeah, so if you do genogram video, and the one example these guys use is Star Wars, but you get so many examples. The video is good as it shows you like which ones to add into there. I posted one within the assignment, but usually like squares, female, circle, squares, whatever route you choose, and then have like a key at the bottom. I would put my stuff out there on blast, but that actually is all my real info, so maybe I should keep it more confidential, but you can find so many examples all over that thing.
And then that's, I don't remember, is that due today or on the 22nd? You can do it on the first one, right?
Right, I thought it was
Okay, yeah.
I usually give you guys 2.5 weeks to do the first assignment.
Okay.
So,
Alrighty.
yeah, then we'll do the eco map next, but that should give us just enough time to get over for our horticulture therapy grant.